Done well, eye bag removal surgery isn't about stripping the fat out. Why does the area under my eye start to bulge? Your eye sits on a pad of fat held back by a thin sheet of tissue. With age, that sheet weakens and the fat pushes forward. That bulge is what we call an eye bag. Just below it, here, the groove where the lower lid meets the cheek begins to hollow, and the shadow between the bulge and the hollow is what reads as a tired.
My concern is my, eyes and folding eyes, like look so tired all the time.
It's tired?
Yeah, and then also the bags. Yeah.
밑에는 이제 여기 루산 이것도 노화 때문에 생기는 거고 해부학적인 특징 때문에 생기는 거 두 가지 원인 때문에.
Do I really need a surgery or can filler handle it? If the bulge is mild and the real issue is the hollow, filler or fat grafting can fill that groove and soften the shadow. But if the fat is clearly pushing forward, adding just volume on top only makes it look more swollen. When the bulge is the main problem, you have to deal with the fat itself. I hear there are two ways to do this. Which one would I have? It comes down to one question. Does loose skin need to come off? If your skin still has good tone and only the fat is bulging, I go in from inside the lower lid so there's no cut on the outside and recovery is quick. If there is loose skin and sag along with the fat, I make a fine incision just under the lash line so I can tighten the skin at the same time. So if you are younger with firm skin, it is usually the first. If your skin has loosened a bit, the second.
이 펫은 리셋이라고 그래서 이제 리포션이라고 하고 리셋이라서 여기를 이쪽 아래쪽으로 좀 옮겨주거나 막을 강화시켜주는 리셋하는
For all the fats in here, he will be repositioning it.
Oh,
so
okay,
it will
that's
make
what
it a
I-
smooth
Okay.
line instead of having the bulb.
Yeah, okay. I was thinking because that's what I'm worried about. Because if you remove the fat, it's gonna be like hollow, you know. So that if you keep the fat, that means it's gonna.
Yeah, he will be repositioning the,
Yeah.
all the fat in the certain spaces, so it will make a smooth thing.
Do you remove the fat or move it? The old way was to simply cut it out, but that often left the lid hollow and sunken, which ages the face rather than refreshing it. Now the standard is to move the bulging fat down into the hollow below where it fits the groove instead of being thrown away. If there is excess after that, I trim only what is left. The aim is not how much fat comes out. It is a smooth line from lid to cheek that doesn't cave in.
Move to the lower eyelid. Lower eyelid there is eye bag. And below the eye bag there is a groove. There's groove more getting deep. And then also skin loosen here. Quite loosen a lot. And then this is laxity also quite a lot. So in the case we want incision here, and this eye bag is instead of removal, we're gonna use where this bulging pad is transferred to the lower depression portion to make the smooth this area.
I want my dark circles gone. Will this fix them? Sometimes, but not always. And it depends on what's actually causing them. If the darkness is a shadow cast by the bulge and the hollow, surgery can clear it. But if it comes from the skin itself, either pigment or fine vessel showing through the thin skin, the surgery won't change that. These often overlap, so before anything else, I work out what's actually driving yours. What about scarring? And I heard the lid can pull down. Going in from the inside the lid leaves no scar at all, and even the incision under the lashes, once healed, is very hard to see. The lid pulling outward comes from taking up too much skin or operating on a lid that was already loose without adding support. It isn't the method itself. That's why I stayed conservative with how much skin I remove. And when the low lid is loose, I add a supporting stitch at the outer corner to tighten and hold it in place. So, why have eye bag surgery at all? The bulge and the shadow under your eyes are among the first things that make a face look tired. And they stay put no matter how well you sleep or what makeup you wear. Done well, eye bag removal surgery isn't about stripping the fat out. It's about restoring a smooth line from the lid to cheek, and once that's there, the eyes come back into focus and the whole face looks rested again.